Hi ma'am, good morning po. Okay, so I am your student nurse for today. I am Brion and I will perform assessment. Okay, so may I know your name po ma'am?
Jennifer Brion.
Okay, Jennifer Brion, ma'am Jennifer. Your age po and birthday?
My birthday is January 8, 1971. My age is 51 years old.
Okay, so we have to check the information of our patient to know if they are the right patients that are assigned for us. Okay, so today, ma'am, I will explain to the patient what we are going to do. Okay, so today, ma'am, I will perform assessment to you. Okay, assessment of your skin, hair, and nails. Is that okay with you?
Yes.
Okay, so we are going to perform that so we can avoid any complications or any mistakes, okay, or abnormalities that may occur in the future. Is that okay with you, ma'am? Okay po. Okay, so let's assume that this is the examination gown. Okay, please, ma'am, wear po. So we have to put examination gown on our patient so that we can make sure that all of the skins will not be exposed. Okay, so if there are skins that are still exposed, we can use towel so that it can be closed. So now that our patient has the experimentation gown, we are going to inspect her skin. Okay, so the first thing that we have to do is to inspect the skin colorization. Okay, so ma'am, okay, so in skin colorization, we have to check the color of her skin. Okay po, bababa ng hand. Okay, if there are any bluish in color or maybe yellow in color. Okay, so we have to check if it's normal or not. So in my patient's case, her skin is normal because it is on the light to light brown range or brown range. Okay. So now that we are done inspecting the skin colorization of our patient, we have to check if there are any skin lesions that are present in her skin. Okay, okay. So in here we have to check if there are any bruises or any wounds, any cuts that are present in our patient's skin. So in my patient's case, I can see no bruises or any signs of skin lesions that are present. So, if there are any skin lesions that are present on our patient, we have to note it. We have to note its size as well as its temperature, its color, something like that. Okay, so now that we are done with the skin lesions, inspecting the skin lesions of our patient, we have to check her temperature. Okay, so in checking the temperature of our patient, Mrs. Jennifer, we have to use the dorsum of our hands or the dorsum of the palm of our hands. Okay, so we are not going to use the front or the palm of our hands because these are highly sensitive and we may have different or not accurate temperature. So, while using the dorsum of our hands, we have to palpate the skin of our patient. So if your patient has skin lesions or something like that, we have to use gloves. But since my patient doesn't have any skin lesions, it's okay for me to use my bare hands. Okay, so let me check your temperature, ma'am. Okay, so as I can see or I can feel, the temperature of my patient is normal because it is not too hot and not too cold. So I can see or I can feel that its range is okay. Now that we are done checking the temperature and the moisture of our patient, we're going to check for skin turgor. Okay, in checking the skin turgor or inspectioning the skin turgor, we are going to pinch the skin under the patient's clavicle or the collarbone. So, ma'am, ito lang po. Okay, so this is the clavicle of our patient, and we are going to pinch it. So once that we pinch it, it must go to its normal color, okay, for at least 3 seconds. Okay, in my patient's case, there are no skin turgor because the patient's skin color back to its normal color. Okay, so now that we are done with checking the skin turgor, we are going to check for our patient's edema. Now we are going to check our patient's edema. Okay, so ma'am, may I invite you to put your fit po here. And so in checking the patient's edema, we are going to check its foot. Okay, so we are going to palpate her skin. Also look for skin lesion. So if the patient has a skin lesion, we must use gloves. But since my patient's skin doesn't have skin lesions, we don't have to use gloves. Okay, so in checking the patient's edema, we must see that the patient's skin must go back to its normal color. Okay? Kabila naman. Okay, so now in my patient's case, we don't see any presence of edema. Now that I am done checking my patient's edema, we are going to check her nails. Okay, ma'am. Okay, so in checking her nails, we must see or we must inspect the nail color. Okay, so we must check if there are any wounds or any clubbing that is present on the patient's nail. Okay. We must also check her capillaries. Okay, so it must go back to its normal color once we pinch it. Okay, so as far as I can see, there are no clubbings and there are no wounds as well as any skin lesions on my patient's nails. Okay, so now that I am done inspecting the nails of my patient, I am going to inspect now her hair and scalp. Now, in inspecting the hair or the scalp of our patient, we must use gloves in case there are any hygiene that is poor on the patient. Okay, so in checking the patient's hair, okay, so this is not the normal glove, this is the surgical gloves, but let's assume that it is the gloves that we use for assessment. Okay, so we can see that her scalp is pinkish in color, which is normal. Okay, there are no signs of dandruff or any lysis. Okay, the patient's hair is also healthy. Okay. Okay, there are also no signs of lost hair, which is good. Okay, so now that we are done inspecting the hair of our patient and the scalp as well as all that we did earlier, going to remove now the PPE that we have or we are wearing. So for me, it is the gloves that we must remove. Okay. So now that we are done inspecting the hair, the nails, as well as the skin of our patient, we are going to inspect now her head and her neck. Okay, so now let's proceed with the assessment for the head and for the neck. So with my patient, we are going to do this assessment so that we can avoid or prevent any further problems that may occur in the future. Okay po? Okay, so we must always say the reason why we are doing this assessment. So, first is the head. We must see if the patient's head is right in size as well as with her body. Okay, and then we must see the symmetry or if pantay ba yung left and right side ni patient. So, as you can see, in my patient's case, symmetry naman yung kanyang head. Okay, so her left and right ears are symmetrical. Okay, as well as her eyes and her nose. So, in that case, it's okay. Okay, so now we are going to palpate her ears. Okay, and then her chin. So, we must see if she can do the facial expressions freely. So, ma'am, pakipikit po ang inyong mata and then dilat po. Okay, dilat po kayo. Okay, so ma'am, smile nga po, smile. And then side. Okay, so as you can see, my patient can do it freely and hindi siya nahihirapan. So, in that case, mas okay yon. Okay? So, it means okay naman yung facial expression ni patient. And then, ma'am, nga po kayo. And then, sarap. Okay, so, ayan. We must palpate here in the mandible, okay? Dito sa mandible side niya, dito sa may jaw side niya, if okay. If walang nagki-click sound, so it means okay si patient. Isa pa nga po, ma'am? Okay. So, okay naman po si patient. Now naman, as you can see naman sa color ng face ni patient, okay naman, hindi siya maputla, hindi rin siya namumula. So, it means okay yung face color ni patient. Now, we are going to check naman yung skull ni patient. Okay, in checking the skull, we must use the gloves. But since si patient naman ay hindi naman poor yung hygiene niya, we can use our bare hands. So, in checking the skull, so i-check natin if meron bang malambot or if there are any problem with the skull. So, ayan. So, wala naman. So, in my case, there are no problem with the skull of my patient. Let's see if there are any lesions with my patient. So, as you can see, okay, wala namang any skin lesions that are present on my patient's head, okay, as well as her neck. Okay, so now we are going to check her trachea. Okay, so let's palpate her trachea. Okay, so we are doing this so that we know if naka-align ba sa gitna yung trachea niya or medyo baliko, ganyan. So, in my patient's case, it's okay. Naka-gitna siya. So, it means it's healthy. Okay. So, if you have stethoscope, you can use the ring of the stethoscope to feel or to hear if normal ba yung sounds dito sa part ng neck niya. But since I don't have stethoscope, I can use my hands as a shoeing. Okay, so as I can see naman, as I can feel it, okay naman yung sa may tracheal part ni. So now, after checking the trachea of our patient, we are going to check if there are any enlargement on her thyroid or on her lalamunan. Okay, so as I can feel, wala naman bukol or any signs of problem. Okay, so nakikita ko naman, okay naman si patient. Okay, so now that we are done assessing the patient, so tapos na tayo sa head and sa neck ni patient, as well as the hair, the nails, and the skin of the patient that we did earlier. It means tapos na or we are done with the assessment of our patient. So once that we are done now with the patient's assessment, we are going to say it to the patient. Okay, so Ma'am Jennifer, your assessment is done po. So, if you have any question, you can ask me. Meron po ba kayong tanong?
Wala naman.
Wala naman po. Okay, so, for more evaluation po, ita-transfer ko po kayo sa ibang nurses. But as of my assessment to you, okay naman po kayo, healthy naman po yung mga in-assess natin kanina. Okay po? So, now, okay, thank you po. Okay, so now that we are done explaining and saying the goodbyes to our patient, syempre, i-remove na natin yung mga gamit na ginamit natin. So, okay ma'am, alisin ko na po ito. Okay. So, po. Okay, and then, if you have any PPE na ginamit nyo, so you can also remove it na. And then, of course, we will say goodbye and thank you to our patient's time. Okay, so Ma'am Jennifer, thank you po for your time and for your patience po with me. So, thank you po ma'am, and you will receive any messages po from the clinic po later. Thank you po
Thank you,
ma'am.
ma'am. Thank you
Okay.
rin.
So, now that we are done with that, thank you for watching. Bye-bye! Bye!